Now, as NEHAWU Strike intensifies, the Health Committee of the South African United Business Confederation urges all the parties involved to find a solution that will be in everyone's best interest. The strike has now entered its second week after NEHAWU announced on Sunday it would cause chaos at public institutions across the country. The Confederation says we simply cannot afford any more bad publicity, especially not where our healthcare is concerned. But let's speak to Dr. Angelique Coetzee, the chairperson of the committee, just to find out exactly what they think from the horse's mouth. Dr. Coetzee, thank you very much for your time here on eNCA. Of course, a lot of people are worried about the fact that this strike is also, causing just the South Africans, especially those who rely on the public health system, not to be able to actually gain access to healthcare.
Yes, good morning. You're absolutely correct. So if we look at what is the right, so we know that Section 23 of the Bill of Rights accords that all your healthcare workers have the right to strike, but it is also conditionally limited by Section 36. And we also know that Section 64 of the Labour Relations Act reiterates that every worker has a right to strike, but Section 64 or 65 qualifies a general right to strike in that individual who provide essential services. They may not participate in the strike action. So public service healthcare workers may therefore not enter protected health strike actions in the absence of a minimum service level agreement, and there is no minimum service level agreement. And to come back to your question, Section 27 of the Bill of Rights mandates the right to access healthcare services. Everyone's got a right. And the National Health Act and the Patients' Rights Charter have been enacted to realize Section 27, also stipulating the precise rights and responsibilities of patients and healthcare workers. Currently, as I've already said, have no right to strike, and any such claim would violate the patient's right to healthcare. This is in a nutshell, and we're not seeing that.
Yeah, well, the Labour Court just a few moments ago, Doc, has upheld that interdict, actually preventing NEHAWU from continuing with this strike. And I guess, as an association or a confederation, rather, you welcome this move. And, what would be your message to those members, in terms of adhering to the interdict?
Well, we definitely welcome this move. And NEHAWU was also instructed to before 1300 hours, 1 o'clock today, to actually send out a notice to all their members, hospitals, clinics, any institution where their members might be striking belonging to essential healthcare services. So we hope that will happen. Then, as you correctly said, it is being interdicted. So we are appealing to NEHAWU in the healthcare sector, please adhere to the interdict. We, in the interest of ethical healthcare, in the interest of transparency, of openness, you need to be able to adhere to those regulations. And then we also ask the members of NEHAWU, those of them who provide essential services, to also heed what is now being interdicted this morning by the Labour Relations or the Appeals Court. This is not acceptable, what is currently happening. Whilst everyone's got a right, as we have already said, you can strike, but it needs to be within certain parameters. We need to make sure that in your strike, that the vulnerable people of this country are not being affected. And currently, it's the vulnerable people who sits in the middle of this, I call it a chess game. And they are mere pawns in this whole saga, where you have government on the one side and your trade unions. And we're not saying that the trade unions that doesn't have a right or that have legitimate reasons to strike, but there should be better ways to deal with this.
Yeah, without trumping on people's rights to access healthcare, right? But also, as the United Business Confederation, are you not concerned about the trajectory of South Africa as a whole and in general? Because remember, we did see that unprotected strike by Eskom employees, which are also essential service workers, and it seems as though that set the precedence in terms of, more government employees disgruntled, of course, rightly so, because of a lack of increases with their salaries. Aren't you concerned that this is going to just aggravate everything, because it looks like even those who've signed on paper to say that I'm an essential service worker and I will not go on strike, but they do now. They do it anyway now.
Yeah, so you're absolutely correct to get there as well. We have had some WhatsApp messages this morning that people, essential workers in certain of the hospitals, are also threatening their co-workers via WhatsApps to, so that they are going to remove them forcefully from their jobs. So that is not of the working place. That should never happen. We cannot allow that type of thing. If you want to strike, do it again legally. There must be other avenues. So government must sit with the bargaining council, come up with a better plan. How are we going to do this going forward? There should be clear rules and regulations and guidelines around, if you want to strike, what do you need to do? I'm not talking about especially essential healthcare services, although you're not, but they cannot really strike. They can strike in their lunch hour, but they can't really strike in the way that we've seen now. And there should be a compromise. This reflects extremely bad in the rest of the world. We need investment in our country. We need to uplift the poor people, but no one will come and invest in South Africa if you don't have good electricity, healthcare services, all of that.
Absolutely, and we are a country that has already been grey-listed. Thank you so much for speaking to us, Dr. Coetzee. She is the chairperson of the South African United Business Confederation.